Welcome to the deep dive. Today, we're pulling back the curtain on something that, let's be honest, often feels like a total black box: medical billing. Yeah, if you've ever just stared at a medical statement, totally confused, wondering why a claim got denied, or maybe why a bill just seems off, well, this deep dive is definitely for you. We're going to try and untangle two really fundamental steps that have a huge impact on your healthcare experience, usually way after you've actually left the doctor's office. We're talking about demographics entry and charge entry.
That's right. And these two, they're really the bedrock, of what the industry calls revenue cycle management, or RCM. It sounds technical, but it's critical. Our source material for today really lays out these stages, and it hammers home just how vital accuracy is. Getting it right means timely payments, smoother operations. It affects everyone. And it's actually pretty fascinating how seemingly small mistakes right at these early points can cause massive ripples through the whole system.
Right. So our mission today, we want to turn these maybe kind of dry-sounding administrative steps into some real aha moments for you. We'll show you exactly where the common slip-ups happen and, importantly, why understanding this stuff can actually lead to faster reimbursements and, honestly, just a less frustrating experience for you as a patient. Ready to jump in? Okay, so let's picture this. You walk into a clinic, right? First thing, someone's usually checking your details. That brings us to this demographics entry. What exactly is it, and why is it so, well, vital?
Well, demographics entry is all about getting your personal and insurance details captured accurately, putting them into the billing system, or, more often now, the electronic health record, the EHR. And here's something that might surprise you. Errors right here in these basic details. They're a major cause of claims getting rejected right off the bat or payments getting held up. It's a huge efficiency drain.
Okay, so what kind of info are we talking about? Beyond just name and address, what gets collected here?
Oh, it's pretty comprehensive. You've got your basics: full name, gender, date of birth, phone number, email. Then your address is residential, maybe mailing if it's different. And then the big one, insurance. Primary, secondary insurer if you have one. Policy numbers, group ID, the plan name, all that jazz. Plus, guarantor information. That's who's actually responsible for the bill, which isn't always the patient, like for a child. And specific to the visit, who referred you, the type of visit, and this is crucial: authorization or pre-certification numbers if they're needed. Those are often missed. And finally, identifiers. Patient ID, maybe social security number depending on the place, medical record number.
Wow. Okay. That is a lot of detail. So I give all this info at the front desk or maybe online beforehand. What's
Yeah.
actually happening behind the scenes to get it into their system correctly?
Right. So the process usually kicks off with patient registration. That could be right when you check in, or sometimes before the visit, maybe over the phone, or increasingly through an online portal. Then comes the data entry part. Staff are keying all this into an EHR, or what's called a practice management system, the PMS. That's the software handling the admin and billing side. Then, hopefully, there's verification. Someone should be double-checking that it's all complete and accurate. That step's important. And probably the most critical step for avoiding problems later, the insurance eligibility check. They need to confirm your coverage is actually active before or right around the time of service. This can be done in real time, like an instant check, or sometimes in batches. Okay. So this is where things can really go sideways for the patient, right? Where do the most common mistakes pop up in this demographics part? Yep.
Exactly. This is a major pain point. Common errors our sources point to are things like, well, simple misspelled names. Sounds basic, but it happens. Incorrect date of birth, wrong insurance ID numbers. Those are huge. Also, a mismatched patient insurance relationship. That's like listing the patient as the main subscriber when they're actually a dependent on someone else's plan. And like I mentioned, missing prior authorizations. If a service needed pre-approval and that number isn't entered here, the claim's almost guaranteed to be denied later.
Yeah, I can see how a simple typo could cause chaos down the line. That mismatched patient insurance thing sounds particularly tricky. Can you, walk through how that might actually affect someone? Oh, absolutely. Let's say your teenager goes in for a checkup, but somewhere in data entry, they accidentally list your teen as the primary policyholder, not you. The insurance company gets the claim, sees the mismatch because your teen isn't the subscriber, and boom, rejection instantly. So now you get a bill you weren't expecting, and you're stuck making calls trying to explain this basic data error to both the clinic and the insurance company. It just turns into this frustrating, time-consuming mess, all from one little mistake at the start.
Yeah. Okay, so let's say they get all my details right. Whew. What about the actual medical stuff? The services I received during the visit? That must be the next step, right?
Exactly.
Yeah.
Once your info's locked in, the focus shifts to what actually happened during your appointment.
Hmm.
And that brings us to charge entry. The whole purpose here is to get all the billable services, every consultation, test, procedure inputted correctly into the billing system. And each service has to be linked to specific codes. Medical procedure codes, those are CPT or HCPCS codes, and diagnosis codes, the ICD-10 codes. It's basically like translating your entire visit into this standardized language that payers, the insurance companies understand, got to have all the right detail.
Okay, translating the visit. I like that. So how detailed does this translation get? What specific bits of information are they capturing during charge entry?
Oh, it's incredibly granular. They need the data service, obviously when it happened, provider info like which specific doctor or nurse practitioner saw you and who's officially billing for it. Their unique IDs. Place of service is important too. Was it in the office, a hospital, maybe telehealth now? Each has a different code. Then the core, procedure codes. The CPT or HCPCS codes for each service. Like 99213 is a common one for an office visit. And the diagnosis codes, the ICD-10s. Why were you there? What did they find? Like J01.90 for acute sinusitis, for instance.
Mhm.
Sometimes they need modifiers, too. These are little two-digit codes added to the CPT code to give more information. Like maybe the procedure was done on both sides of the body, or it was distinct from another service on the same day.
Modifiers. Okay, so extra details in the procedure code. Got it. What else?
Units or quantities,
Mm.
how many of something was provided, like units of medication administered or maybe number of lesions removed,
Mm.
any authorization number again if that specific service needed prior approval. And finally, the fee amounts. How much are they charging for each service? This is usually based on pre-negotiated fee schedules with the insurance company.
Man, that is meticulous. So the doctor finishes their notes, maybe uses an encounter form.
Yeah.
What's the workflow for the billing team to actually get all this coded and enter?
Good question. It starts with receiving documentation. That might be those old school paper encounter forms, or more likely now, notes directly from the EHR. Then code assignment. Sometimes the provider picks the codes, but often a certified medical coder reviews the documentation and assigns the precise ICD, CPT, and HCPCS codes. Accuracy here is paramount. Next, entering the charges into the actual billing software. And this is a really critical step, linking the diagnosis to the procedures. The system needs to connect the why diagnosis with the what procedure to prove medical necessity. This avoids a ton of denials. Then there are usually internal validation checks within the software looking for missing info, illogical combinations, things like that. And only after all that, the charges are forwarded to scrubbing. That's like an automated quality check looking for errors before the claim goes out the door. And then finally, claims submission to the payer.
Okay, so if demographics is the who and where, charge entry is the super detailed what and why. So what happens if mistakes creep in here? What's the fallout?
Well, the consequences of charge entry errors hit the bottom line fast.
Eh.
For the provider, you could have underbilling, basically leaving money on the table because you didn't charge for everything correctly. Or you could have overbilling, which is a huge compliance risk and obviously unfair to the patient. And for the patient and provider both, you get denials. Especially if those diagnosis and procedure codes don't line up properly, the insurance company just says, nope, doesn't make sense.
No.
And all of this inevitably causes significant delays in getting paid, which really impacts the provider's cash flow and operations. Remember, this charge entry data flows directly into creating the claim, the insurance billing, and eventually that statement you get in the mail. So yeah, accuracy is absolutely crucial. It's not just ticking boxes.
Right. It's like building with faulty blueprints. Okay, so we've looked at demographics entry and charge entry separately. How do they really connect? How do they stack up against each other in the big picture?
Yeah, it's good to compare them. They're distinct, but they absolutely have to work together. Think of it like this. The goal, Demographics is about capturing patient and insurance details. Charge entry is about capturing the services rendered for billing. Who does it? Demographics is usually front desk staff, maybe central registration or other RCM folks. Charge entry is typically done by medical billers, often certified coders. When it happens, demographics is before or at the time of the visit. Charge entry is after the visit, once the clinical documentation is done. The tools. Both use the EHR, definitely. But demographics also relies heavily on that practice management system, maybe insurance portals for eligibility checks. Charge entry is more focused on the billing software component, coding resources, and the impact of errors. Demographics errors mess up eligibility, cause initial rejections. Charge entry errors mess up the reimbursement amount, cause denials based on medical necessity or coding rules. You see the difference.
Yeah, definitely. Different roles, different timings, different impacts if they go wrong. But bottom line, it sounds like they are both absolutely critical entry points, right? Like the first two major gates, the information has to pass through correctly.
Exactly. You nailed it.
Mhm.
They are the foundational inputs. And the overall conclusion from our sources is crystal clear. Getting the information right at both of these stages is the key. Accurate demographics and accurate charge entry lead to fewer rejections, fewer denials, much faster payments for the providers, which helps keep the lights on. Importantly, it means a better, less confusing, less frustrating experience for you, the patient. Plus, it ensures everyone stays compliant with all the complex rules and regulations. It's kind of amazing, really, how these seemingly small internal administrative steps have such a huge ripple effect across the entire healthcare system, right down to your own wallet.
Absolutely. So, thinking about all this, what does it really mean for you listening right now? Hopefully, you've got a much clearer picture of all the meticulous work that happens behind the scenes long after your appointment is over.
Yeah, and maybe connecting it to the bigger picture, it just highlights the sheer level of detail required to make sure the right care gets billed appropriately. And hopefully it empowers you a bit too. Now you can maybe understand why a bill looks a certain way or feel more confident asking questions if you get a denial because you know where those issues often start.
Definitely. So, here's a final thought to leave you with. Knowing just how critical accurate information is at every single step for smooth billing and getting those reimbursements processed quickly. What's the one piece of information you'll make absolutely sure is double checked and spot on the next time you register for a medical appointment or interact with your provider's office? Something to think about.